I'm a plastic surgeon, and my specialty within that specialty of plastic surgery is hand surgery. I also do peripheral nerve surgery, and I'm also specialized in microsurgery, so any type of reconstruction. It doesn't have to be the upper extremity. I can do reconstruction of head and neck, breast, abdomen. When I see my patients in the clinic and see that they're having trouble getting their hand to function, I can really empathize with them, and I try to imagine what it's like to go through what they're going through. Our hands are so important to our lives. We use them to take care of ourselves, to feed ourselves. They're our method usually of earning an income, and if something happens to our hands, it's amazing how we lose the ability to function in this world. Restoring that function is an amazing process that can restore somebody's livelihood and can make them independent again. And I've heard it over and over from patients how grateful they are that they have been given a chance to start living their life the way they want to again. And that gives me great satisfaction.